Waiting 1 minute to allow all of them to enter.
I think you can start. It's fine.
Okay. Good evening, everyone, and welcome to the third webinar in our One Health webinar series. Today, we are gathered virtually to explore One Health in action, navigating challenges and opportunities in the Eastern Mediterranean. I am Dr. Saeed Abu Khattab, and it's my pleasure to moderate today's discussion. We are joined by esteemed experts who bring a wealth of knowledge and experience from across the region. The concept of One Health, emphasizing the interconnectedness of human health, animal health, and environmental health, has gained international support. Yet, our region has seen minimal participation in global One Health events, with only a few educational and awareness events recorded over the years. This highlights a critical need for increased engagement and action within the Eastern Mediterranean to address our unique challenges and opportunities. Today, we aim to delve into how different countries has navigated these challenges, the role of the One Health Joint Plan of Action, and how we can collectively enhance our effort toward a more integrated approach to health challenges. Please join me in welcoming our distinguished panelists. We will start from Geneva. Dr. Amina Ben Yahya. Dr. Amina Ben Yahya, currently leading the WHO One Health Initiative. She has been with WHO since 2002, focusing on a communicable disease, food safety, and One Health. Her expertise spans global health activities under the International Regulation Framework, IHR 2005, antimicrobial resistance, and multi-stakeholder partnership. Dr. Amina, floor is yours.
Thank you. Thank you very much for the very nice introduction. I will start by sharing my screen. Can you see my screen?
Oh, not yet.
Okay. You see my presentation?
No, not yet.
Okay, it worked when we were doing it just before, so we'll start again. You see it now?
Yes, now.
Okay. Good.
Can you change it to presentation mode,
Yes.
please?
Yes.
Ah, perfect. Perfect. Thank you.
Good. Thank you. Thank you, everyone. And first of all, I would like to say that I'm very, very pleased to be here and be given the opportunity to give you an opportunity of the work of WHO, but also for the with the partners at global level. I would like to start by saying that One Health is not a new concept. I think that we are all here together today to discuss One Health, but we all recognize that One Health is not new. And before starting my slide, I would like just to remind ourselves about the sentence that our DG always mentioned in many of his speeches, that human health does not exist in a vacuum, and nor can our effort to protect and promote it. So the close links between humans, animals, and the environment health demand close collaboration, communication, coordination between all the relevant sectors. with this, I would like to show you how it all started. I think that we all recognize that there has been with the different epidemics but also with the recent COVID-19 pandemic, there has been a high recognition for One Health in addressing the multi-dimension health, water, energy, food security, and biodiversity challenges that link the health of humans, animals, and the environment. This slide showed that at the 74th World Health Assembly, a resolution on strengthening WHO preparedness for and a response to health emergency was adopted. And this resolution is calling the DG to build and strengthen the existing cooperation among WHO, FAO, WOHA, and UNEP, and develop a common strategy on One Health. This resolution also has asked member states to adopt this multi-sectoral coordination approach that we will be talking today. But furthermore, to show that we are also going beyond communicable disease, beyond zoonoses. At the 76th WHA, a resolution was passed on 24th May 2023, calling for an action to scale up effort to fight the impact of chemical waste and plastic pollution on human health. And really, it's the first time ever that the health effect of chemicals and plastic pollution has been directly addressed at the World Health Assembly. Next, in this slide, I would like also to show you the tripartite collaboration on One Health, telling that WHO, FAO, and WOHA have been working together for decades, and their work was formalized, as you can see on the left, by the tripartite concept note in 2010, where there was a focus on AMR, on zoonotic influenza at the time, and on rabies. But then in 2018, it was further strengthened by an MOU. But as the understanding of the complex interaction between human, animals, and the environmental health continued to evolve and grow, there has been I would say, a need to have a more comprehensive and interconnected approach to the One Health. This led to the tripartite collaboration into the quadripartite collaboration on One Health through the signing of an MOU, including the UN Environment Program, UNEP, in March 2022. So the quadripartite was established, coordination mechanism to facilitate this collaboration. So just to reflect on how we work at global level, we have a secretariat where the chairmanship is on a rotation basis. We have a focal point, a quadripartite senior management that is meeting regularly, and we have an annual executive meeting where it's involving the 4 DGs, where they meet face-to-face on an annual basis to review the progress, but also discuss on the agreement and action for the upcoming year. At regional level, and I think my colleague Heba will further elaborate on this, there is also a quadripartite regional coordination mechanism that is in most of our 6 WHO region, trying to ensure that there is an alignment between the global and the regional One Health initiative. In this slide, you will just see how the quadripartite work together to advance the One Health through the global quadripartite secretariat. So the function of the secretariat includes 3 main streams that you see. The first one is really about providing the policy, the advice to try to enhance the One Health advocacy at global level. The second is around the development of One Health related strategies, providing capacities building and supporting countries in implementing the One Health. And the third one is about strengthening the evidence and knowledge. This has led to One Health initiative and quadripartite project that help really facilitate the One Health approach at all levels. OLEP, the One Health high-level expert panel that I will further detail later on, was established by the quadripartite. You could see it in 2021. It really serves as the advisory role for the 4 institutions to ensure that all the high-level strategy and policy are based on evidence and science. And they had a critical role in supporting all the work of the quadripartite. In this slide, I just wanted to show you the quadripartite call to action that during the first quadripartite executive annual meeting, it was last year in March 2023, Under the chairmanship of WHO, the 4 DGs signed a call to action to reiterate their commitment to continue collaborating on One Health under the framework of the One Health Joint Plan of Action. This call to action is urging not only countries, but also all stakeholders to undertake the priorities action. The first one is around policy advocacy, really trying to prioritize One Health is in the international political agenda, to increase the understanding and advocate for the adoption and promotion of intersectoral One Health governance. The second one is about the strengthening national One Health policies, strategies, and plans, so that we have plans that are costed, prioritized, and in line with the One Health Joint Plan of Action. The third one is about accelerating the implementation of these plans. The fourth is about the workforce development. It's very important to build intersectoral One Health workforce that have the skills and the capacities to be able to prevent, detect, control, and respond to health threats in a timely and effective way. The fifth one is about strengthening and prevention of pandemics and health threat at source, really targeting all the activities that increase the risk of zoonotic spillover between animals and humans. The sixth one is about really encouraging and strengthening the One Health scientific knowledge and evidence. And the last one, and not least, is around increasing the investment and financing on One Health strategies and plans, just to ensure that we have a scaled and implementation at all levels. In this slide, I just wanted to show you the One Health in the political agenda, because political commitment is crucial for the continued advancement and implementation of the One Health approach. And for this, as quadripartite, we are engaged in many political forums to try to raise awareness and global commitment on One Health. As I said, we are actively engaged and involved in the intergovernmental negotiating body, the INB process. As you know, the INB was established by WHO member state to draft a new pandemic instrument to strengthen pandemic prevention, preparedness, and response. And we have been involved in ensuring that One Health is included and reflected in the instrument. In March 2022, we have established a group of friends. It's comprised of member states that are interested in helping us to advance and scale up the One Health. The quadripartite has also engaged with the UN General Assembly last year at the UNGA high-level meeting on pandemic prevention, preparedness, and response, to play a high-level event in New York, where we drafted and we contributed to a political declaration on PPPR that was adopted by the head of states, and calling for the importance of applying a One Health approach. This year, another high-level meeting will take place on OMR, and it really provides further opportunity to advocate for the One Health approach at the highest level. As quadripartite, we also work closely with many political forums, such as the G20, the G7, the G7. And as part of this, we have hosted various side event, attended high-level meeting on One Health, and we have co-drafted One Health policy brief and technical document and declaration for countries that really outline the One Health approach and the set of key activities and action that country can adopt to enable One Health implementation. And this year, under the current G20 Brazil presidency, we will host a high-level seminar on One Health that will be convened in October, just a day before the G20 ministerial meeting. And we are shaping this event, and really this event is a great opportunity for us to facilitate the discussion related to One Health implementation amongst a diverse range of stakeholders at the highest level. As mentioned before, the One Health high-level expert panel, OLEP, was established in May 2021, and really this group is key to provide the technical and scientific advice to the quadripartite in supporting all the provision on evidence-based scientific and policy advice. And this really is crucial to address the health threat at the human, animal, and environment interface. The first term of OLEP was completed in March this year. And they had really a critical role in producing many key outputs and product. I will just list some of them, and I'm sure that we're all familiar with the One Health definition that is today broadly used, but they have a list of tools that were critical for to advance the work of the quadripartite, like the inventory of One Health tools, One Health model surveillance systems, and so on. Now the second term of OLEP started this month, and we have just recomposed our panel, where we have now 29 members, and we have decided to expand the scope of OLEP beyond the zoonoses, and we have added expertise on law, on governance, on social science, ethics, data science, and behavioral science, because we want to bring the One Health component beyond the preparedness and the response, but also beyond the infectious zoonoses. The first full panel meeting was an introduction where we just took place earlier this month, where we have representatives from the different institutions. The role of OLEP 2 now is really around very much focusing on providing guidance on the implementation of the One Health Joint Plan of Action by trying to inform the development of evidence-based One Health policies, tools, and metrics to support the implementation and measurement through the identification of One Health research gaps. The next slide is really to give you an overview of the One Health Joint Plan of Action and its implementation guide. As I said, following the resolution in the 74th resolution, we have asking the DG and the quadripartite to develop this framework. We have had a joint drafting team that started to develop a strategy and action plan. So the joint plan of action really is the blueprint per se that really outlines the commitment of the quadripartite to collectively advocate and support the implementation of One Health. But what is important to say is that this joint plan of action is really building on existing One Health initiative and not rather than really duplicating the existing one. The joint plan of action is guided by a theory of change where and really it makes a use of the One Health principles to strengthen these 4 C's that we always mention: the collaboration, the communication, the capacity building, and the coordination. And this equally across all sectors that are responsible to address the concerns of the human, animal, and environment interface. The joint plan of action is, and I hope that most of you are familiar with it, is really built around 6 interdependent action tracks that collectively contribute to achieve a sustainable health and food system, reduce global health threat, and improved ecosystem management. It was officially launched in October 2022, and we believe by this plan, it will provide a clear vision, commitment, and concrete work plan for One Health. Following its finalization as the quadripartite, we began to develop an implementation guide, which really is a complement to the joint plan of action, trying to help the countries by translating all the objectives and the high-level activities of the joint plan of action into practical guidance that can be adapted to national level context. Then in this slide, I just want to show you the implementation guide. In the middle, you see how it, on the left, you have the 6 action track of the joint plan of action, but in the middle, you have the implementation guide that is based on these 3 pathways that you see of the theory of change. And each pathway is defined by a specific theme, which will serve as cross-cutting factors that can be applied to each action track from the joint plan of action. If you see the first one focuses on policy, legislation, advocacy, and financing. The second one is really related to organizational development, implementation, and sectoral integration. And the third one is related to data, evidence, and knowledge. The action tracks of the joint plan of action have been well designed, and significant progress has has been made of each of these by the relevant technical program within each of our institution. Therefore, really the aim, as I said before, is not to duplicate this effort, but we choose to base implementation through the 3 pathways as they are applicable to all 6 action tracks. So by this, we very much encourage countries to design their national One Health frameworks and work plans according to the action tracks and the 3 pathways of change that you see for a holistic approach for One Health implementation. In this slide, I think maybe also WEBi will mention, but we wanted to, with the publication of the Joint Plan of Action and its implementation guide, effort have been made to direct to regional and country support. The global team is organizing and has been organizing very closely with the regions, joint regional and country One Health workshop, trying to support really the regions and the countries to adapt their strategies for operationalizing and implementing the One Health approach in line with the Joint Plan of Action. The quadripartite has organized 2 regional One Health workshops covering countries and sectors in EMRO, in Eastern Mediterranean region in May 2023, and in Asia Pacific region in September 2023. And this was really a high recommendation from the 4 DGs to really try to translate the implementation of the Joint Plan of Action into all the 6 regions. So this year, we will have regional workshop for Africa, America, and Europe. Europe will take place in June in Austria, and we are trying to plan for the Africa and the Americas. For when it comes to country level workshop, we have started supporting implementation in Bangladesh, South Africa, Cameroon, and Kosovo, and we are planning subsequent national workshop to really enable country level implementation. So these workshops have really provided an essential means to quick start national level One Health Joint Plan of Action implementation. And I will finish by this slide just to show you what's ahead of us. We have a lot of work, and during the recent quadripartite executive annual meeting in March this year, the quadripartite identified 4 key priorities for our future work. The first one is about promoting and supporting the implementation of the One Health Joint Plan of Action at country level. I think that we have done a lot at global level, at regional level. Most of the work has been done, but I think now the focus is really to make the impact at country level, generating and sharing science and evidence for the implementation of the One Health approach. A third one is about maintaining the political engagement and advocacy for One Health I don't like to say in a post-pandemic world, but in a world where pandemics are still at high risk. And the fourth one is about strengthening the coordination and core support to the quadripartite secretariat. And this includes sustained funding and resource mobilization to try to ensure this sound delivery of the quadripartite priorities. So by these priorities, the quadripartite is really committed to work together to advance the One Health approach for the health of humans, animals, and the environment. And with this, I thank you for your attention.
Thank you, Dr. Amina. Thank you for this very interesting presentation that put us what is happening at international level. Now we are moving to Egypt, from Geneva to Egypt, and looking what is happening at a regional level from WHO also. Dr. WEBi Mahrous. Dr. WEBi Mahrous, a veterinary epidemiologist working as a One Health technical officer at WHO EMRO since 2018. She provides a technical guidance to strengthen capacities at human-animal environment interface, and has been instrumental in developing One Health operational framework for countries in the Eastern Mediterranean region. Dr. WEBi, floor is yours.
Thank you so much. Can you see my screen now?
Yes, perfect. Thank you.
Okay, so thank you, everyone. First, I'd love to, thank our colleagues at Efinet for the kind invitation. I'm so honored and thrilled to be a part of this successful story and this webinar. Second, let me, second. Hmm? Yes. So our presentation today, from a regional perspective, we'll just, touch base with four main items. The first one is very briefly about the One Health concept, and then we will dig into the regional perspective and activities of the One Health, passing by the quadripartite regional perspective. And finally, we will zoom into the One Health operationalization and implementation in Eastern Mediterranean region countries. First, as Dr. Amina mentioned, the One Health approach or the word One Health is not new, but as you can see that it was started in 2004, the word One World, One Health. So we are almost speaking about 20 years of spreading the word of One Health. Recently, as Dr. Amina has referred to the high-level expert panel as one of the milestones of advancing One Health globally that was formulated recently to guide the 4 DGs of the quadripartite. So one of the main products the OLIP has came with is to again look at the One Health concept and the One Health definition. So what is presented here is a recent One Health definition. As you see, it's an integrated unifying approach which recognizes that the health of humans, animals, plants, and the whole ecosystem are closely linked and interdependent. As you know, that the One Health has started to shed the light on infectious diseases, more specifically on zoonotic diseases. But by the time of applying the One Health approach, it's really proven capability to serve more technical areas. So it really serves vast technical areas that needs collaboration and coordination across sectors. And this has become a key approach, for example, for areas like the food safety, AMR, and so on. So all these areas that threaten the achievement of the SDGs targets on health, environment, economic development, and sustainable production and consumption. Now, moving to the regional perspective of One Health, just I will take you a step back to 2019. So 2019, at that date, we developed the first version of the regional One Health operational framework. And at that time, it was just, focusing on zoonotic diseases. So it was named One Health operational framework for MRO's focus on zoonotic diseases. And then we had updated this one to be aligned with the strategic directions of the quadripartite One Health joint plan of action. And we had now a new version called Regional One Health Operational Framework. And this, covers all the areas of the One Health. And this regional framework has been developed based on the finding of several assessments, like the GEE, the Joint External Evaluation, and the BVS for the veterinary services as well as SPAR and other assessments. And this has been, done in close consultation with the regional and sub-regional offices of the quadripartite. The Regional One Health operational framework focusing on 5 strategic objectives, starting from establishing governance and leadership, fostering the multi-sector coordination at the national level, and then passing till, having early warning and information sharing system well established and functioning at the national level, then how to enhance the preparedness and response capacities at the national level. Finally, to develop a skilled multidisciplinary workforce that is assigned to take care of all what we mentioned about the One Health related activities, including achieving these strategic objectives. Now passing to a very important step within the journey of One Health within our region is, we succeeded to present a technical paper on advancing the implementation of One Health during the regional committee. For your kind information, WHO regional office and IMRO, and also the same, I guess, applies for other regional offices, is organizing on a yearly basis a regional committee involving the ministers of health for the 22 countries. And a few papers only accepted to be presented to the ministers, and they approve them. So we were lucky in 2022 during the 69th session of the RC to present a paper on the One Health. And also we were more lucky to have a resolution to support the operationalization and implementation of the One Health in the region. And mainly focusing the resolution in how to help the countries to institutionalize the One Health approach and to build the internal linkage between the different sectors and establish a multi-sector coordination mechanism, and also how to adapt a national One Health operational framework. And finally, to prioritize interventions and activities with the existed limited resources to tackle zoonotic diseases and other threats like the food safety hazards and antimicrobial resistance. From a regional perspective, within the paper and the resolution, it was a commitment to establish a regional quadripartite One Health mechanism, and also to support the member states to move forward with the application and implementation of the One Health approach. Then now buzzing to the quadripartite regional milestones on advancing the One Health. As you just mentioned. Hello? Yes, so one of the milestones is, as just presented, is presenting the technical paper on advancing the implementation of One Health. Then issuing the resolution and passing by other great activity within FAO regional office. Sorry. Yeah. So the FAO regional office has, had the 36th FAO RNE conference for the Near East in January 2022. So it was the same year, at the beginning of the same year, we presented the paper to the regional committees. He also presented, a plan to these regional conference members to establish a regional One Health platform. And finally, now we succeeded to establish a regional One Health platform. And this platform has 3 layers or 3 levels. The first one is a One Health committee, the One Health steering committee. And this steering committee involved RDs or the same level, the senior managers of the 4 organizations. And then One Health coordination group as a second level to coordinate the One Health between the organizations, and finally expanding to have connection between the technical staff from the 4 organizations under the name of the One Health Technical Group. The recent achievements we had as a region and sub-regional offices here for the quadripartite is to have a regular meeting and communication and coordination since April 2022. And that's why it was a very good, platform to discuss, for example, the technical paper for One Health before presenting to the regional committee. And then we had developed the regional One Health action plan, and this is in line with the regional framework and also One Health GPA. It's just to align our forces on how to support the member states to operationalize the One Health in line with both the regional and global perspective. So it was an internal document for us. And then in October 2023, during the regional RC, the 17th one, FAO joined the Regional Health Alliance as the 17th UN organization. And really, this is a crucial step that would provide an excellent opportunity to improve coordination within the UN agencies. Finally, the FAO has a regional office has succeeded to present or to develop a project on the One Health regional platform. Finally, as a regional and sub-regional offices of the quadripartite, we have participated in numerous global meetings like the annual executive quadripartite One Health meeting, the first and second for 2023 and 2024. And also we had organized a One Health event as pre to the regional FAO conference organized in October last year, and finally also participated and had for the first time a One Health session within the quadripartite global MERS meeting that was organized last November. This is another step in our journey is how we as a quadripartite supported member states to operationalize One Health. So we had, collaborated and supported the member states through different activities. So one of them is to enhance a multi-sector coordination mechanism across sectors through different tools. Like, for example, we use the MCMOT, the multi-sector coordination mechanism operational tool. And this is one of the tripartite zoonotic guide operational tools. For other countries, we supported them to have a One Health Hub or the One Health Committee, like we did in Egypt. And it's a higher, level of coordination at the level of the ministers, and then followed by a second level of coordination, and finally technical working groups. I guess Dr. Behr will shed a light on this. For other countries, we supported them to have maybe One Health technical working group for specific diseases or specific area. So we had different modalities. It depends on the country perspective. It depends on the country context and so on. One of the issues we supported countries within EMRO to do is to develop or adopt a One Health national framework or operational plan or even roadmap in alignment with the regional and global plans. We used a lot of tools. One of the key tools we used or the program is IHR-PVS National Preparation Workshop, as we had, conducted in numerous countries, as you see. And for other countries, we just had, a national consultation, workshops, seminars, and meetings to align resources and to bring all the sectors to develop their own national plan. One of the exercises, which is so efficient, is I consider it one of the crucial steps to align the views and to have a consensus to move forward with a One Health agenda is to agree on the list of diseases that of high priority for all sectors from a One Health perspective. So we use the CDC One Health Zoonotic Disease Prioritization tool, and it was applied in Jordan, Sudan, Somalia, and UAE, and I hope soon we will have it also in other countries like Egypt. Finally, we haven't forgotten the workforce development through different approaches and tools, like the joint risk assessment, for example. It's almost done in most of the EMR countries, whether having training of trainers or training for the nationals, or even some countries has step down training at the sub-national level, as has been done in Pakistan and Egypt, for example. Outbreak investigation of foodborne diseases also, it was a training in close collaboration with our food safety unit within EMRO, and involving the quadripartite as well. Finally, one of the tools, or not the tools, the activities we have done is supported some countries to raise the awareness on the One Health for the professionals of the human, animal, and environment authorities, like the One Health curriculum done for Jordan and for Egypt, in line with the tripartite zoonotic guide. And then finally, now Infinite is leading the development of the One Health FATP in Egypt, and we are, one of the partners that helping Infinite and the Egyptian authorities to have it for the first time in our region. The last slide I have is just to present or summarize the quadripartite perspective. So our focus during this year and next year is to implement what we agreed on in our One Health Regional Quadripartite Action Plan, to explore together joint funding opportunities to support member states, to continue supporting the capacity building programs and training for the staff, also fully operationalize the regional One Health platform, undertake more of the joint risk mapping and assessment that inform the preparedness interventions, and finally, support member states of our region to adopt and implement the national One Health plan. I stop here. Thank you.
Thank you, Dr. Hiba. Thank you for your presentation and comprehensive presentation what is happening at regional level from WHO. Now we will look to we are moving now to Jordan to see what is happening at countries level, and we will start from Jordan with Dr. Muhammad Khashan. Dr. Muhammad Khashan, he is a veterinarian at the Epidemiological Surveillance Department at Jordan Center for Disease, CDC, Jordan CDC, with background in veterinary medicine and animal pharmacology. He focuses on disease surveillance and public health initiative in Jordan. Dr. Muhammad, floor is yours.
Thank you, Dr. Saeed. Good morning, good afternoon, good evening for all of you, wherever you are. First, I would like to thank my colleague in AFNet for this opportunity. I would like today to talk about the initiative from the Jordan CDC for building an integrated surveillance system in Jordan. First of all, I will briefly just speak about the GCDC and this mandate in surveillance. Then I will go straight to the point. Okay, this is the
Dr. Muhammad,
organization.
Dr. Muhammad, can
Yes.
you put presentation mode?
Okay, now?
Yes, perfect, super.
Okay. So this is the organizational structure of the Jordan CDC. You see in the brown color the administrative units, and down we see 6 directorates: Technology Information System Directorate, Emergency Preparedness Directorate, Epidemiological Surveillance Directorate, the place where I work, Disease Prevention Directorate, Laboratory Directorate, and Research and Training Directorate. We will focus here today on the Epidemiological Surveillance Directorate and Technology Information System Directorate, as they are concerning in surveillance more than other directorates. For the vision and the mission of GCDC, we are looking for excellence and innovation in public health, preparedness, surveillance, prevention, response, research, and the policy guidance. And our mission also in the surveillance, strengthening disease surveillance and response, and promoting evidence-based health policies and decisions. This is one of our objectives in surveillance directorate. We are looking in the monitoring epidemics, communicable diseases, and health threats, not only in human and also in environment, agricultural, animal, and climate change. And we want to evaluate and analyze data from other related national surveillance system that we have it in the ministries and the other entities here in Jordan. And we want to publish regular report and presentation outputs of national surveillance and guides to guide the policy and practice in different platforms. So here, let us talk about the public health surveillance. What is public health surveillance? According to American CDC, it's a systematic and ongoing collection, analysis, and interpretation of health-related data to do what? For planning and implementation and evaluation of public health practice. This is the general definition of the surveillance. But we want to talk about the integrated disease surveillance. Integrated disease surveillance is a combination of active, passive systems using a single structure that gathering information about multiple diseases and behavior of interest. Let's focus here. It's a single infrastructure, have multiple systems, multiple surveillance systems, and multiple diseases and behavior of interest. Let's say we are going towards the One Health in this definition. But what is the One Health surveillance? The One Health surveillance is a systematic collection, validation, analysis, interpretation of data. So it's the same concept of the surveillance, but now we are focusing in human, animal, environment. This is to form a decision for more effective and efficient and system-based health intervention. Actually, till now, there is no current consensual definition for the One Health surveillance, but in 2019, the tripartite FAO, WHO, and WHO developed a tripartite zoonosis guide. This zoonosis guide was developed to provide the guidance and explain best practice for addressing zoonotic diseases in the country. The outcome of this zoonosis guide was surveillance and information sharing operational tool for developed to support national authorities and establish strengthening in their coordination, multi-sectorial surveillance, and information sharing for zoonotic diseases. This is the joint action plan. Actually, I don't want to talk too much about it. My colleague, Dr. Amina, I think she talked in details about this one, but let's just fast we say about the pathways. Pathways focusing in the policy and legislation and advocacy of and financing, organizational development implementation of sectorial integration for pathway 2 and pathway 3. It was for data evidence and acknowledgement. This is the action track. Actually, also my colleagues talk about it, but between these action tracks, there is sub-tracks and activities that some of them, they are focusing in strengthening the One Health surveillance in the targeted countries. In 2023, the One Health high-level expert panel that published a paper for developing a One Health surveillance system. They just put the steps and the guidance for the countries of how to develop the system. The step one was developing a surveillance system scope. Step two, that was identifying the data requirement. Then step three was developing a system design. Step four was developing the system governance. Step five, develop integrated protocol. And step six was developing joint implementation roadmap. From our initiative, I think we are just now moving from step one to step four, and I think in the future step five, and we will apply for step five and step six. So this is the outline of our initiative. The integrated surveillance system is a One Health integrated surveillance system initiative from Jordan Center of Disease Control. We are aiming to doing a study of mapping and gap analysis of national communicable disease surveillance system health disease surveillance health information system. We want also to do a comprehensive mapping and gap analysis of available documents about Jordanian's communicable disease surveillance system. Then we want to establish a data hub using data warehouse technologies. Then we want to do data integration and visualization. See, this is the first study. Actually, this study is conducted by Information Technology Directorate. It was about mapping and gap analysis of the national communicable disease surveillance set in Jordan. They did it in steps. The first was stakeholder mappings, mapping of the stakeholders, then define the project objective and methodology, then a situation analysis and benchmark marketing, and then finding appropriate technical blueprint to extract the data from the source to our data warehouse. This is the objective. It's mapping and sorry.
Dr. Mohammed, sorry for interrupt you, but you have 3 minutes.
Yeah, I will try to finish fast. We conduct map and gap analysis. This is the study. It was done for 3 phases. Actually, was in stakeholders mapping and data collection tool. Then we did the comprehensive disk review and the stakeholders disk review, and then benchmarking according against the National Public Health Institute. Then phase 3 was designing a technical IT requirement. That one is for the blueprint. Then we conduct another study. It's for comprehensive mapping and gap analysis for available document. It was for mapping and reviewing existing disease surveillance policies, strategies, guidelines, SOPs related to epidemic and communicable zoonotic diseases within One Health, in addition to antimicrobial resistant and health-related environment threat. So this study, it was for the strategies and the guidelines and SOP documents, not like that study. It was focusing in the systems. This study, it's conducting for GCDC by Jordan University, the University of Science and Technology, and still in progress. Here I want to talk the data hub, the data warehouse. It's the data warehouse is the central repository that aggregates the data from multiple sources and support decision maker. It's essential for considering diverse health data and enabling comprehensive analysis which support effective disease management. See here, we can see here the established national data warehouse. We are extracting data from Ministry of Health, Ministry of Agriculture, Ministry of Environment, Ministry of Water and Irrigation, public health sources, private data sources like private labs, and we can also in the future add any source that we want. We are doing something called ETL, extracting, transfer, and load. Then we load it to a national data warehouse. What is the ETL? ETL is extracting the data from different sources and transforming to fit the operational need and loading it to a database or warehouse. It's example, we have here an example in zoonotic diseases. I don't want to talk about it because of the time. In the PIT, we have real-time dashboarding, real-time to provide visual interface to track and analyze data, offering insight at glance. Like trend analysis, we can find the change in the trend of the diseases. And the data integration, we can just demonstrate the trend for more than disease or more than the disease sources. Risk alert, we can put automatic alert for any risk that we can found it in the system. And end of the day, we can just generate a report and interactive maps from this system. Thank you so much.
Thank you, Dr. Muhammad Khashan, and sorry for the time, but we need to fix the time to cover all the countries. Now we are moving back again to Egypt, but now to the government in Egypt and to Dr. Baher Dsuki. Dr. Baher Dsuki, he is the director of the One Health Department at the Preventive Medicine Sector, Ministry of Health and Population in Egypt. With background in epidemiology, he has been at the forefront of One Health coordination and implementation in Egypt. Dr. Baher, nice to meet you here, and the floor is yours.
Thank you, Dr. Said. Thank you for Infinite for hosting and organizing this webinar series. Hello, everyone, wherever you are. I am going to have a quick overview regarding the One Health approach in Egypt, a brief background with recent advances focusing on the strengthening and improvements that we did regarding the governance and leadership mechanism in Egypt regarding the One Health approach. So Egypt used to participate in all joint activities that were considering collaboration and coordination with other members. And one of these events was the International Ministerial Conference for Avian Pandemic Influenza that was held in Sharm el-Sheikh, Egypt, 2008. At that time, we had, I think from my opinion, that it was a very big start that pushed this joint work in Egypt that was called the four-way link in 2011. It was formed of epidemiologists and lab experts from both Ministry of Health and Population and Ministry of Agriculture and Land Reclamation, representing public health sector and veterinary sectors, and it was supported at that time by the WHO Country Office and FAO in Egypt. By the time we had a support by the Prime Minister Decree number 101 in 2015, that was the support given from the government to this four-way link to follow the activities regarding avian influenza. Then we started expanding our network and moving from the concept of four-way link to the One Health Technical Advisory Group, starting 2016, 2017, and it was formally endorsed in 2018. It was like an expansion for the four-way link, having more participation from other relevant sectors, mainly the Ministry of Environment, and also it considered covering another diseases, another zoonotic diseases rather than avian influenza, and also covering antimicrobial resistance and other One Health related issues. Then when Egypt was preparing to host COP27 in November 2022, we used this momentum and joined efforts of all the government ministries and institutions in Egypt, and we started working together with our colleagues from different ministries and institutions on drafting our national strategy for One Health. We started by drafting the national strategic framework, and then we had a second step, which was the national operational plan. So for the strategic framework, we started in June 2022, sorry. We had the initiative, started formulation of a technical working group, received nomination from other ministries and institutions. Then we had a preparatory meeting and a series of meetings until we had our final draft that was endorsed in April 2023. And it was endorsed in a high-level meeting that was, as you see on the left, you will find His Excellency, the Minister of Health and Population, and on the right side, Her Excellency, the Minister of Environment, and other ministers from different ministries and head of institutions across Egypt, and also with participation from World Health Organization, FAO, and more than one UN organization working on Egypt and other relevant stakeholders. At that time, we had our national strategic framework, which is a long-term strategic document with 5 years lifespan. It focused on the vision, mission, main priorities, directions of the country towards achieving One Health. It focused on 5 technical themes that they are not that big different from the global and regional perspectives, focusing on improving and enhancing the capacities, controlling zoonosis and vector-borne diseases, focusing on food and water safety issues, and curbing the pandemic of antimicrobial resistance, and also integrating environment into One Health. Within each theme, we agreed with partners that we should fulfill a group of capacities that are presented in this slide: the governance and leadership aspects, and enhancing capacities, surveillance, early warning, and joint risk assessment. The fourth is joint planning, preparedness, and response, then effective risk communication and community engagement, and also covering cross-border and partnership networking and the applied research and innovation. Also, in this national strategic framework, we agreed on the organizational structure of the One Health framework in Egypt, having the ministerial committee with the ministers and the head of institutions, then the Supreme Coordination Committee that is formed by the senior decision makers in these relevant ministries and institutions, and they are working to follow up the joint work by these 4 technical working groups, one concerned for zoonotic disease and vector-borne, the second for the food water safety, and the third for antimicrobial resistance, and the fourth one for environment and One Health. Then we moved to the second phase, which was working on the operational plan. Once we had our launch in April 2023, we started by remapping our stakeholders, expanding the participation from different experts from the relevant organizations, focusing on different technical themes agreed in the national strategic framework. And then we moved.
Dr. Beher, you have 2 minutes.
Okay, thank you. Then we moved to agreement on our activities, timeline, and indicators, and we had a final draft by January 2024. And we are hoping that we will endorse this full strategy regarding One Health in Egypt by June 2024. This is mainly focusing on governance and strengthening this governance structure in Egypt that pushed the efforts for One Health in Egypt, but also at the same time, we worked on a diversity of technical activities that are covering the different themes agreed in the strategic framework. You will find technical working groups on the below right corner, discussing the indicators for the operational plan and the SOBs for the working groups. You will see we are about to finalize a risk communication strategy for antimicrobial resistance in Egypt. And we are, as Dr. Heba mentioned, we are preparing to have the One Health FETB in Egypt, and we are working on this. And this photo that you are seeing in the up left corner is for the One Health research prioritization workshop that we had today. It was today, and it is the start for prioritizing the research agenda for One Health in Egypt. And we are hoping to finalize this research agenda by the end of May, inshallah. Finally, I would like to highlight that some of our best practices that helped us to reach this moment is the regular meeting with colleagues, the sharing surveillance data, joint development of guidelines and operational plans, this joint risk assessments that were done jointly on regular basis. Also, we have a rapid response workforce that also works jointly. And as Amina said, we in Egypt, with this strong political commitment that helped us to have this national One Health strategy in place that was launched in April 2023. And finally, in Ministry of Health, we had a One Health department that I am honored to be the first director for this department. Before I close my presentation, I really appreciate and want to thank all our colleagues from relevant ministries and institutions that their dedication and hard work helped us to reach this moment. Thank you for everyone, and we are looking forward to continue our work together. Thank you. Thank you.
Thank you, Dr. Beher. Very nice presentation and precise presentation. Thank you. And now we are moving from Egypt to Pakistan to Dr. Morsaleen. Dr. Morsaleen, CEO of the PAC One Health Alliance in Pakistan, bring a significant insight from managing One Health initiatives and strategies within a complex regional context. Dr. Morsaleen, floor is yours.
Thank you very much. Am I audible? Am I audible?
Yes. Thank you.
Thank you very much. And thank you very much for this nice introduction. And I'm really thankful and delighted to be part of this team presenting our experiences. So my talk would be mainly on the work that we have been doing with the governments and provincial and national governments for the promotion of One Health. And recently we completed a project on One Health event-based surveillance, which was supported by Rockefeller and ending pandemics. You see, and I would like to share my experience, our experience on that. And certainly we have like some case studies, and because that was also part of the question here that was sent to us, the case studies on One Health. So I would like to present those case studies. So our organization, a quick introduction, was established in 2014 to work and to promote the concept One Health. It is very well established and recognized by all the relevant ministries and departments. And the main strength, in addition to our team and in addition to our offices and at the national and the provincial levels, we have a very good affiliation with the multiple government departments, because One Health is an intersectoral, multi-sectoral challenge. So we need to have connections and a relationship with the departments. We have board of governors, and we have already signed a number of MOUs, both with the national and international organization, and lucky to get a similar MOU with Infinite about 2-3 months back. So, but we are very much delighted to be part of this process. So I will first be talking about the One Health event-based surveillance project that we recently implemented. The theme of the project was to make early detection, to make verification, then you share this information at a central level and generate generate evidence for joint action. So we developed, as part of this, the main was to develop some ICT solution that encourage sectoral collaboration for early warning, to support early warning system, implement some One Health guidelines, tools, courses, SOPs for infections, diseases, and train key stakeholders in timely detection response to the outbreak signals. So this was not like a countrywide project, but we did at the policy level, at the national level, and then we organized some training of trainers workshops on this, both at the federal level and at in the province of Punjab. So this is the products that we were able to produce during this time. We did a mapping exercise. We did we developed training manuals on One Health and event-based surveillance, because in our country and maybe in others also, the indicator-based surveillance is very common. But indicator-based surveillance, you know, is the scope is limited to the number of facilities reporting. And for example, in our country, this is limited to the government type of facilities. The private sector is not reporting at all on that. So event-based surveillance was very critical for us. In that sense, probably we were the first to promote the cause of event-based surveillance in Pakistan. So this was like our project completion workshop that we organized in March 2023. So this particular project on One Health event-based surveillance was actually launched in 5 countries, and Pakistan was one of those countries, and we were the focal point for this type of project. And so as part of this project, we developed a dashboard, integrated data dashboard, enabling One Health surveillance and early one. But just creating dashboard was really a big challenge, because the surveillance systems of multiple departments are differently organized, and their definitions could be different, their SOPs could be different. So, and they are not used to sharing any data to, earlier not used to sharing of data to other departments of ministries. You see, they were using with themselves. But we we started with health and you see the livestock department to start with, and probably later on we thought that we'll be also incorporating information from the environment sector and the food security section. So the outcomes of this One Health EBS project were able to set models of One Health intersectoral coordination. We created committees on intersectoral coordination, and you see the federal government and the provincial government, we were like the enablers, you see, the facilitators, because this is an NGO. So we were enablers, and luckily we had very good relations with all the main players in this concept. And we developed guidelines, and a large number of federal and provincial managers and field staff were from public health, veterinary, and vector-borne disease program were trained in EBS, event-based surveillance, detection, response, epidemics, outbreak, and One Health protocols, you see. Experience gained in this EBS One Health project was showcased widely, you see, both at the national and international level. Monitoring of the project outcomes to the predetermined project timeline metrics, that was done. So I will be now discussing some of the, because we wrote a paper on One Health case studies in Pakistan, and these are the you see sections from that paper. So a dengue was spread in the country. And
Dr. Morsaleen, you have 2 minutes. So sorry for interrupt you.
Okay, thank you. So dengue was one of the, in the case study, it was very well organized. And so many departments were, you see, aligned to each other, like the human, animal, environment, social sciences, WASA, the fisheries department, police. And this was first time in the history of the country that so many departments were aligned, and there was you see, showing coordination, both at the provincial level and at the district level. And a lot many, you see, approach the salient features. You see, it was a very holistic kind of management of dengue, and that created case studies to be followed for other diseases and for other situations also. Then the recent COVID control, there was a National Command and Control Center established, which was coupled with the Provincial Command and Control Center, all provinces and members, and envisaged for three. You see, there was use of technology, clear and effective public messaging, coherent governance and policy recommendations. Those are made. And several departments like Ministries of Finance, Climate Change were part and parcel of the steering and the technical group meetings. You see, it is not only health dealing it, and so many FETP program, NIH, international partners were it. And at the end of the day, luckily, we were able to manage the COVID situation in Pakistan. There are some other isolated examples, but you see unfortunately, these examples are ad hoc based examples, but you see some kind of trend or culture of having a continuous, regular, you see the One Health studies or One Health patterns are missing. And every time there is an epidemic, you see this is to reduce. So some isolated but scalable option of One Health implementation available, coupled with, but at the policy level, the One Health is very well realized, and it is felt that it should be promoted. There is a general awareness and sensitization at community level and at multiple level, intersectoral coordination. So no significant but regularly among different departments. Limited evidence for joint actions or joint operation is there. Absent of integrated surveillance is missing. Certainly, the surveillance programs of livestock, they are different. But recently, we created this example of integrated dashboard. You see, One Health. But that was a beginning that we made. But there were still so many challenges in that context also. Lab facilities, the test kit word problem, deficiency of a common platform to bring academicians, public and private, regular platform is missing, and that needs to be promoted and developed both at the public and private sector. And there are some other players and stakeholders which have to be brought to the net of this platform. So thank you very much. The recommendation, need for an active and One Health Secretariat, governance and regulatory frameworks has to be devised, extensive sensitization, integrated One Health disease surveillance and monitoring mechanisms need to be promoted. Education department, media needs to be activated for One Health. Areas like food security, environment and waste management are not very active in One Health. It's only livestock and you see, and the public health. We need to have broader plans for One Health operationalization, and recent use of One Health joint implementation. You see the process that WHO started. Probably it has to trickle down to the country level and also to the provincial or even to the district level. So thank you very much.
Thank you, Dr. Marceline, and thank you all the presenters for this nice presentation. I know we have time, so now we will open to the Q&A question. So if anyone has question, please put it in Q&A. Actually, we have now many of the questions, but I will start with the first one. Actually, the person who asked this question didn't mention for whom should answer this question. So I choose, maybe I will start with Dr. Baher. It's okay. The question is, how difficult is to get surveillance data from private sector?
Thank you for the question. I think, yes, I know it's somewhat difficult, But in Egypt, our colleagues at the surveillance and epidemiology department are working to engage our colleagues at the private sector, working on advocacy, highlighting the importance of sharing these data and having pilots and maybe demonstrating the benefits and the importance of sharing these data. And by the time we are expanding our work with the universities, with the private sectors, and other agencies working in the area of providing health. Yes, I know it's somewhat difficult, but we can do.
Okay, as we know, the One Health is transdisciplinary approach, not only multidisciplinary approach. So the same question to Dr. Morsali. Can you answer the same question? How difficult is to get surveillance data from a private sector?
Yeah, I think it is difficult. Sure, difficult, but it is healthcare commission, health authorities, especially in the province of Punjab. So probably they are already taking some steps.
I think,
to
Dr.
be
Morsalin, you have a problem with your internet connection.
you know, I'm
Okay,
not audible.
I will back to you to answer this question. If you have a problem, I will move now to another question because we don't have time. Now the question is to Dr. Hiba. Can you share one or two country case studies on successful One Health implementation? I mean, at regional level, of course.
Yeah, we have a lot of examples. I guess one of the pioneer countries in operationalizing the One Health is Egypt, as Dr. Beher mentioning. So they start from having an operational plan, operational framework, strategic framework for Egypt, and really it was endorsed by 5 ministers. I was so happy to be a part of this success story. Besides moving on to have an operational action plan. Then we succeeded all together to have capacity building sessions, including joint risk assessment, and now moving to and One Health curriculum, and moving to the One Health FTP now. In addition to this, they also establish a One Health structure involving, the steering committee, technical teams, and so on. This is for the One Health, besides a lot of success stories concerning the food safety and AMR as well. So Egypt, I guess, one of the successful countries. Besides Egypt, we have also success stories in Jordan. So they had undertaken the prioritization exercise, the first country in our region to undertake this exercise. And then it was followed by surveillance information sharing, assessment, and having a One Health plan, having information sharing, even database shared between the sectors, moving to the One Health curriculum, ended by the simulation exercise, even to test their capacity, simulating using the avian influenza examples. So these are a few examples within our region, but yeah. Our stars.
Okay, so thank you for your answer, but this lead me to another question from same person. When you say OH-FETB, do you mean using the existing FELTB through One Health approach, or it is separate curriculum?
So this one has been initiated by our colleagues in Infinite. We have on the call Dr. Said and other colleagues. So they initiated the development of the specific One Health curriculum. That is the same for FTB, but with, within the touch or the perspective of the One Health. So this is the initiative, and they shared with us the curriculum. Now we are working, and we will have a workshop next week to we can say make it matching the Egyptian context. So this is what we meant by the One Health FATP. Dr. Said also
Okay.
to add more
From your
pieces.
Thank you for your answer. Now, from the same answer from Dr. Heba, she mentioned to Jordan as a second or as an example for success story. Now, the question to Jordan, to Dr. Mohammed Khashan, how many one outbreaks investigated by GCDC?
Thank you, Dr. Said. Actually, if I fully understand the question, GCDC is not working for direct outbreak investigation. GCDC are working in coordinations with the ministries for supporting them and supporting them in anything related to the diseases and the outbreaks. I don't have an exact number for the outbreaks, but as I told you, we are just supporting the ministries and doing the investigation and implementing some procedures to just strengthen the activities of the ministries.
Okay, thank you. I will back to Dr. Morsaleen to answer the questions about including private sector in surveillance, how we can take or use the data from private sector.
Thank you very much. Am I audible now? Am
Yes.
I audible?
Yes,
Okay,
yes.
thank you. So I was just discussing that we have a healthcare regulatory authority for the private sector in some of the provinces. Probably that could be they need to get registered there, you see. So, and they are already sensitized about that. And probably they are not actually playing at this stage any role. For example, the Punjab Healthcare Regulatory Authority, but probably they could be motivated and you see they could be oriented to these aspects. And currently the getting information private sector is not that easy. It has been done in the COVID regime, COVID-19, you see, tenure. But it's not a norm. It's a difficult process, but not impossible. It is doable. It has to be done through the regulatory authorities, which are, you see, there, and they can play a role in that context. Thank you.
Thank you, Dr. Morsaleen. And now, the most biggest question to Geneva, to headquarters, WHO, Dr. Amina. The first one, how can you compare the One Health concept with other dire health needs of least developing countries in terms of putting them in the priorities?
I think what to compare would be difficult, but as I mentioned in my presentation, is that we have developed an implementation guide, and this implementation guide is really, I put the link in the chat, and I think that it will really give a practical guidance for countries to implement the One Health approach, starting from having an assessment of the situation, what is in place, what needs to be done. But I would like to say something, but most of the time they tell us, oh, we need more fund to implement One Health. While I can convey with some of the idea that we need more fund, but most of the time the activities don't require additional funding, but it's a different way of working. I think governance coordination is key. Sustainable funding is key, but I think that the way that we work, establishing a governance or coordination, planning between the different sectors, and Heba mentioned the integrated surveillance, sharing information, collaborating between the different sectors, really requires sometimes not additional financial resources. But I think that what is important is to have a strong governance that enables the different sectors to work together. And then, of course, we need sustainable funding, but the mindset is there, but with an overarching solid governance that enables the different technical programs to come together. So I think that I always come back to the four C's that I mentioned in the beginning. The collaboration, the communication, the coordination is a different way of working.
Okay, thank you for this to answer this question. And briefly, this question, I know we need maybe 1 hour to answer this question, but we don't have time. In light of the challenges mentioned, such as poor health system, political factors, what strategies have been most effective in fostering cross-sectoral collaboration and communication for One Health implementation? I know we need 1 hour to answer this.
I think it's not an hour. I think it's 2 or 3 days brainstorming because there are many strategies.
Yeah, yeah,
Um,
I see.
And in your question, I think there are at least 10 questions that need to be.
Yeah, but
Maybe I give the floor to the other colleagues to give the example of the
maybe
region.
Dr. Heba?
Yeah, one of the modalities some countries used is to sign a memorandum of understanding between the heads of the sectors, and this was done, for example, in Sudan, and it was a very successful story. I cannot miss really to sign this memorandum of understanding with specific TRs and areas of work and collaboration across sectors. From a One Health perspective, the same applies also, I guess, for Jordan. Now we are supporting a number of countries like Tunisia, UAE, who else? Maybe Lebanon. So a number of countries is replicating the same idea, which really originated from Jordan and Sudan. And this is really one of the good modalities we are recommending within our countries. Thank you.
Okay. Maybe briefly, maybe Dr. Morsaleen, briefly in a minute, can you answer this question? What about development RRTS in Pakistan in One Health?
Thank you. You see the Pakistan. Well, there are some movement. There is some activity, but probably not still sufficient. You see, a lot more yet to be done. You see, the national One Health hub or unit that was designated is not very active. But certainly there are isolated activities. We have been doing this project and we have been gathering all these secretaries at our platform. And there is a One Health, you see the strategic planning done already. But you see the action plans are to be developed and implemented. And probably the workshop that Hiba was mentioning, that is very critical for us to talk about the action planning and talk about its implementation. A lot is yet. Pakistan is a huge country, is a you see highly populated country, and we have much bigger challenges if we say compared to Jordan or some other smaller countries. So we have big challenges, but you see we are pushing. We have been, but there's a lot of interest at the policy level, but its implementation is not in a good state. Thank you.
Okay, thank you. Thank you for your answer. Thank you for the panelists. As we concluded today's webinar, I want to thank each of panelist participants, MFNet, for their contribution. The discussion today have not only highlight the challenges we face, but also the potential pathway for stronger One Health implementation in the region. It's evident that the coordination efforts and commitment to intersectoral collaboration are key to our success. We look forward to continuing this dialogue and hope to see increased participation and engagement in the future One Health event across our region. Please stay tuned for follow-up material and summary of today's discussion. Thank you once again for joining us and have a wonderful day. Thank you.
Thank you very much for your invitation.
Thank you, everyone. Thank you.
Yes, thank you.
Bye.
Thank you, everyone.
Bye.